I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Well, today we're going to talk about chronic kidney disease, a silent killer. And I know we've talked about another disease process we call the silent killer, right? We're talking about chronic kidney disease. What's the other one also?
Hypertension, high blood pressure.
Okay. Well, let's talk about chronic kidney disease. What is it?
Well, chronic kidney disease is the disintegration of your kidneys. Mm-hmm. So what happens is you have the material in the kidneys and you filter your blood. And then what you do is you get rid of the toxins, uremia, into the urine and then eliminate it. So it's a filtration process. Mm-hmm. And if the kidneys have been damaged over a period of time, they can continue to get worse and worse and worse. And that's what they call chronic kidney disease. So a failure of the kidneys to be able to heal themselves.
I know you always say that you're as young as your kidneys are.
Yes.
Is that...
Yes, that's absolutely true. There are several different factors that determine biological age. Lungs are probably the best indicator of how long you're going to live, but the kidneys are number two. And you can do blood tests to find out exactly what your kidney age is, and that has a huge effect on how long you can live. Matter of fact, I can look at those two markers on your lung function test and then your kidney disease and pretty well predict on how long you have to live. You know, whether you're going to, live into your 90s or 80s or 70s is pretty much determined by those two things.
It's kind of scary. Well, you've always told me I have healthy kidneys. So.
You have excellent kidneys. You've got the
something going for me.
Kidneys of a 30-year-old.
All right.
There is biological age testing associated with the kidneys. Mm-hmm. So as we look at that's a very, very big factor and something that isn't really that well controlled medically.
Okay. Well, why is it a silent killer?
Well, there are, when you're talking about people who are in stage 4 of chronic kidney disease, where they're actually ready for dialysis, almost 50% of the people who are in stage 4 aren't even diagnosed.
50%. I didn't even know there were stages.
Yeah, there's stages.
Okay.
So there's
kidney disease
or chronic kidney disease.
Okay.
So the failure of the kidneys, that's one of the things that you can get into the AMA guidelines on permanent impairment. Mm-hmm. They have a whole way of rating how the kidneys are functioning based on lab tests and symptoms, hypertension, those types of things. How everything combines, you can get a permanent impairment rating off of that, which is an important part of people getting disability with Medicare. So it's an important part to look at.
Well, you said only 50%. Okay, people that are in stage 4.
Stage 4.
That's just before you go
That's when you're going into dialysis.
Okay. They're missing 50%.
50% are not diagnosed and should be.
And why is that?
A very good question. One of the things is I get people in and I look at their blood work and I said, well, it looks like we're having some problems here. We need to do some further testing. The testing from the average medical doctor is very, very poor. Mm-hmm. So if you don't test it, you don't know. Mm-hmm. And very few people have been going to doctors for years and years and not getting the proper tests to find out if you have kidney disease. The recommendations from the CDC is that everyone really from about the age of 40 on up should be tested on a yearly basis on the functioning of their kidneys. And that's one of the things that we're doing this is a real push. The whole idea of this being a silent killer didn't come from me. Those are the exact words from the Center of Disease Control. And they said, hey, doctors, we need a great deal more information put out to the public that they need to be tested on this. And then we need a lot more from you because you're not diagnosing this properly. And you're not doing the proper tests to find out if that's a problem. Mm-hmm. Because early detection is one of the important parts of working with this. And it's just it doesn't produce any symptoms, so it's a whole type of thing that if the doctor's not checking on it, it's not being done. If you're not going in for your yearly exam, you're not going to find out.
And that's why we promote those yearly, the blood test, the Prather profile, at least once a year, because you said sometimes there's no symptoms.
Sure. It was just like I had a 72-year-old man who came in just this last week. And I said, when was your last blood test? And it had been 5 years ago. And it's like, you need to be doing that on a yearly basis, at least annually, especially when you're, hitting 72.
And insurance covers it. It's not expensive.
It's not invasive.
Yes.
It's an easy type of thing to do, and it gives a world of information. But this is an extremely underdiagnosed disease process, and it is a definite healthcare crisis in America.
Well, I know you're going to talk about the how to diagnose it and that later in the show, but let's talk about how common is chronic kidney disease.
Well, there are 30 million adults in the United States who are diagnosed with it. So it's a very large portion of the population. 340 people start dialysis a day.
Start
dialysis a day.
Not on it. Start it.
Yes. Medicare spent $79 billion on chronic kidney disease, plus $35 billion a year on dialysis. So this is also another reason that the Center of Disease Control and the federal government...
costing them a lot of money.
Right. And one of the big problems is if you can figure this out early, it just, I tell people, we need to work on your kidneys. Your kidneys are starting to become diseased at this point.
Yeah.
And they go, well, why isn't this talked about, elsewhere? Uh-huh. And just too many doctors are not really addressing this and getting strategies to help to keep that under control and reverse it.
Mm-hmm. Well, can chronic kidney disease be lethal?
Yes, the Center of Disease Control ranks that as the 9th leading cause, but it is very underreported because oftentimes if you have chronic kidney disease, it leads to congestive heart failure. And so one of the main reasons that you have the cardiovascular disease is because the kidneys actually precipitated it. Mm-hmm. So, in other words, this is a big reason why people are not living as long, mm-hmm. and creating other different types of diseases. So it's an underlying problem that's kind of insidious and not being addressed as it should be.
Okay. Yeah, I'm just listening to you, and I know those are things you check.
Oh, all the time.
And I've the people coming in, to the Prather practice, and you're doing the blood work. What percentage are you seeing that are having kidney issues?
Only probably about 20% of the people mm-hmm. have normal functioning kidneys.
So 80%.
80%. Mm-hmm. Mm-hmm. It's nice to be able to sit there and say, "Wow, this is great. You've got some different types of problems here, but you're going to live a long time because I can see your kidneys are functioning quite well." Mm-hmm. But people start getting lower and lower on their kidneys, and I say, "Hey, you need to be working on this to keep this from becoming more and more of a problem." Mm-hmm. Because it does cause a lot of different types of issues in people's lives.
Yeah. Well, who gets chronic kidney disease?
Well, the people who get that is the diabetics. Mm-hmm. Diabetes is the leading cause of chronic kidney disease because the diabetes diabetic situation injures the kidneys. In other words, having to handle the excess glucose, it's like a toxin going through the kidneys because it filters it, tries to get rid of it. The different toxins that are created damages the kidneys. So 1 in 3 people with diabetes have serious chronic kidney disease.
1 out of 3.
1 out of 3. So that's the number one reason for chronic kidney disease. Number 2 is hypertension. So 1 in 5 people with hypertension who've been diagnosed also have chronic kidney disease along with that. Now, to be frank with you, everybody who has diabetes and hypertension has an underfunctioning kidney that needs to be addressed. So, if you have hypertension, if you have diabetes, you're damaging your kidneys. Because the kidneys don't show up what we're doing is we're measuring the effects on the kidneys, but the kidneys are pretty resilient. It takes a lot of damage to the kidneys to start showing up. So, you're talking, once it's starting to show up in lab tests, that you are already in an advanced state.
Okay.
And we can start to see things start dropping down to where they really shouldn't be. And it is rare to see someone with a really, really healthy kidney. Where it's really functioning at the high level that it should be.
Okay, when we come back, we're going to talk about the causes of chronic kidney disease when we come back. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather practice. The 3 tests, Dr. Prather, that you suggest everyone have every year, to give a complete picture of health is the Prather Profile Blood Analysis, the GI Effect Stool Kit, and the hair analysis. And what does the hair analysis reveal about a person's health?
Well, one of the most important things that we're looking on a hair analysis is the possibility of heavy metal toxicity. That can cause a huge variety of diseases and symptoms that can actually occur. Any type of autoimmune disease could begin with a heavy metal toxicity, or any type of neurological conditions, MS, ALS. A lot of those types of diseases can be kicked off by heavy metal toxicity, including a whole host of symptoms that would be hard to explain any other way. The other things that show up with the hair analysis is the balance of the minerals. It can play a huge effect on the entire system. Now, when plants actually grow, they can actually make the fatty acids, the vitamins, the amino acids, but the minerals have to come from the ground. So if the minerals aren't there, they can't make them. So the most common deficiencies that can occur in nutritional health of an individual is mineral deficiencies or mineral imbalances. And the hair analysis is the best way to actually show up those changes that can occur.
Well, how does the hair analysis help find the root cause of health issues? And no pun intended there.
When you're actually trying to discover what's going on in an individual, so many things can actually result with a mineral imbalance or a heavy metal toxicity that it really behooves us to actually do that particular test. And that's one reason that I recommend it be done at least once a year. And if there's any type of important type of disease process going on or unexplained symptoms, checking on the hair analysis really can show a tremendous amount and reveal the underlying problem.
Schedule your appointment at the Prather practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather practice, restoring hope. Have you ever been curious about how acupuncture can benefit your health? The Prather practice has received the Indy A-List Award for Best in Acupuncture for 2 years in a row, and we've been rated the top acupuncture provider by Google+. Dr. Robert Prather is a board-certified licensed acupuncturist. He's earned a reputation for combining effective acupuncture-based techniques with cutting-edge technology to help patients with many conditions. Acupuncture is documented and proven to help with many health issues, including pain, allergies, addiction control, anxiety, fatigue, vision problems, infertility, and so much more. We even have needle-free options for those who are a bit squeamish around needles. Call the Prather practice to schedule your appointment and experience the benefits of acupuncture for yourself. 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. Well, we're talking today about chronic kidney disease, a silent killer. And Dr. Prather, before we went to break, we talked about who gets chronic kidney disease, and I didn't let you finish on that on the ratios. Is there a difference between male, female?
Yes, females are more commonly show up chronic kidney disease, but men die from it more frequently. So it's a higher number in women because of just smaller kidneys. Seems to be one of the big factors.
Okay.
But men seem to die from it more commonly, probably because men don't take care of themselves as well. In other words, they don't go to the doctor. But also, there's also some very definite racial imbalances on who gets chronic kidney disease. Much, much higher in African Americans than in any other population. Hispanics are number 2. Caucasians, the population along that has a much less incidence of chronic kidney disease. What we find is it's very rampant within the African American community, and as I'm doing blood work on African Americans, there's across the board a much poorer function of their kidneys than in the rest of the population.
Do you have a theory about that, or?
I am not completely sure. One of the things is I think that the diet has a great deal to do with it. If you go to Africa, if they start to if they have the traditional diet, millet, some of the different types of foods along those lines, they have great kidney function. But when you start introducing a European or American type of diet into there, then their kidneys really respond very poorly. And I think it's the balance of the amino acids. There's a difference along those lines. So that's my own theory. And so I'm constantly talking to the African Americans that they really need to work along those lines because it's creating a lot of the hypertensive type states, and getting the diet changed and adjusting that and supplementing seems to be the best way to kind of approach that.
Yeah, and I've been in Mali, Africa, in the villages, and those were some of the healthiest people.
Right.
I've met.
Traditional diet, it really seems to work quite well, and so getting that adapted is and getting some education along those lines seems to really help along those lines quite a bit.
So, what causes chronic kidney disease?
Well, the number one thing, of course, is diabetes. We had talked about that. That accounts for a huge number of the people with chronic kidney disease whenever they have diabetes. Hypertension is number 2. Number 3 is drugs. Pharmaceuticals, non-steroidal anti-inflammatories, NSAIDs. These is one of the biggest problems for kidneys because it really damages it. So people who have arthritis, other different types of diseases, along with the inflammatory types of of issues, start to use those drugs on a regular basis, and it really damages the kidneys. And so if you start to have a combination of those, then with chronic kidney disease, hypertension, and non-steroidal anti-inflammatories, then you start to really get into some issues. Along with that, antibiotics can really damage the kidneys, dyes, and blood pressure medicine also damages the kidneys. But we've had several different people with a lot of different types of products, and even like the HIV medications can also be something that can kick off damage to the kidneys. Some of the other different types of drugs. So looking at that, I've had several people who've had taken different drugs and then all of a sudden developed chronic kidney disease because of the damage that was done. Genetics is also a factor. Heart disease can also lead to it. Obesity is a contributing factor. Smoking really destroys the kidneys too. Also, any type of obstructions for if you have kidney stones, if you have prostate enlargement, those all can lead to kidney disease also. And then bacterial infections. Having chronic bacterial infections, strep infections is one thing that can go in there and damage the kidneys and then lead to a lifetime of degeneration of the kidneys. So all of those are different types of factors that you need to look at on the kidneys, and then make sure that if you do have chronic kidney disease, that you avoid especially any of the different types of drugs that can lead to that.
Yeah, and I think we think a lot about, prescription medicine and the liver, and the liver's always being checked, the levels.
Sure.
And maybe the kidney's not getting enough attention. I don't know.
Yes, and that is one thing that we've seen where we've done a check on people's medication, and he said, you shouldn't be taking this with chronic kidney disease, And then their primary care physician said, well, I didn't even know they had chronic kidney disease. So, that is part of the thing that we do at the office is we check to see what diseases they have, and then cross-check it with the pharmaceuticals, and it's amazing how many people are on pharmaceuticals that they shouldn't be on for chronic kidney disease.
And we just heard of someone that was on an antibiotic this last week and was having kidney issues.
Correct.
Pretty bad.
Yeah.
Well, how is chronic kidney disease treated medically?
Well, basically what they try to do is to control the diabetes and the hypertension, try to keep those under control. Weight loss is another different type of factor. Dietary changes are also important, but they don't have. There are no medications for chronic kidney disease that help the kidneys. That is a real failure of the medical community. Matter of fact, when I've talked to medical doctors and showed them some of the changes that we're able to make on the kidneys with the changes in blood work, they said, I didn't know you could do that. So we've taken people with 25 glomerular filtration rate up to 60, 65. And
where should they be?
Well, you should be above 60. Anything below 60 is considered kidney disease. But really, it depends on age because there are variations along those lines. But really, the glomerular filtration rate should be in the hundreds.
Okay.
100 and 115 is really where it should be. 85 is considered really a healthy kidney.
And we're going to talk about treatments in this show, but why is diabetes so important to chronic kidney disease?
It's almost guaranteed that if you are diabetic, that you're going to have kidney damage. It's a toxin that's going through the system. It's not intended to be there, and if that is what's going on, you're going to damage your kidneys. So keeping your blood sugar under control, type 2 diabetes should be able to be fixed. there is no reason if you do the things that you're supposed to, that you can't get type 2 diabetes under control.
Right.
Type 1 is a different matter. That is not something that you can fix, but you can take different types of things to help to lower your levels that you have to take on the insulin and keep the kidneys healthy. But that is something that needs to be done. But diabetes is probably the number one thing that is involved with chronic kidney disease.
What role does hypertension play in chronic kidney disease?
Hypertension is the number 2 reason that people have problems with their kidneys and kidney destruction. It's a very interesting type of a sort of a loop, kind of a catch-22. If you start to develop chronic kidney disease, then that leads to hypertension. Hypertension wears out the kidneys because of the extra pressure that goes in through there. The reason that the body raises up the blood pressure is because it's making up for it. It still needs to keep the filtration going, and one of its tactics to do that is to raise the blood pressure. So we tell people that 70% of all hypertension, all high blood pressure, comes from kidney disease, which it actually does. So but then the kidneys wear it down. So the medical solution on that is to take antihypertensive drugs, high blood pressure drugs, to lower the blood pressure, which helps the kidneys. But then the high blood pressure medicine actually helps to destroy the kidneys itself. It actually puts extra pressure on it. So it's the way that my instructors, my mentors said, it's sort of, you've got a donkey and you got a big weight on it. So, and it starts to fail, and you're trying to push it to keep going. So what you're doing is the blood pressure medicine is like you take a whip and start whipping the donkey. The donkey keeps moving faster, so you get a little bit better, but then it actually wears out the donkey quicker. So
why a donkey?
Well, beast of burden. And that's basically what the kidneys are. Yeah, the kidneys are just, they're constantly working. They never quit. They're like the heart. They never rest. So, there are points where you need to use high blood pressure medicine to keep the blood pressure down, but you should be working to fix the kidneys so that you can reduce the high blood pressure medicine so that the kidneys can keep functioning. So you see the loop on that?
Yes.
So you want to help to control the blood pressure with as least amount of damage to the kidneys as possible. And then you want to heal the kidneys as quickly as possible so you can reduce the blood pressure medicine also. So it really takes a lot of
I'm tired already.
In other words, we have to work with the medical, so we're constantly looking at the blood pressure medicine as we are adjusting everything. So it's, because you have to, in other words, we sit down and talk about this quite a bit.
Yeah.
Whenever we're dealing with it.
All right. When we come back, we're going to talk about the role structure function care plays in chronic kidney disease. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
I don't understand nutrition. I heard a nutritionist on the radio saying something like you should eat breakfast like a king, lunch like a prince, and dinner like a pauper. But I think I wrote it down wrong. Because I eat breakfast like a king, lunch like a hippopotamus, dinner like an 800-pound gorilla, and a midnight snack like a 25-ton humpback whale. So, when I was jotting it, I inverted something.
Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com.
I was feeling so bad. I asked my family doctor just what I had. I said, doctor.
I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. Well, we're talking today about chronic kidney disease, a silent killer. And Dr. Prather, let's talk about the role structure function care plays in chronic kidney disease. Structure function care is what we practice at the Prather Practice. We have a team. We have nurse practitioner, MD, chiropractor, acupuncturist, massage therapist, occupational therapist, nutritionist.
All right.
We have a team that makes up our structure function team. So what role does that play?
You can't really, when you're talking about structure function care, what we're doing is we're talking about improving the health of the individual. Really, the only way that you can be able to make a difference on chronic kidney disease, not just slow it down, but reverse it, is through structure function care. Because you're talking about healing the kidneys. Mm-hmm. And healing the kidneys is the answer to chronic kidney disease, and you can't, pharmaceuticals don't heal anything. Mm-hmm. Now, they're very important when you're talking about diabetes. If you are type 1 diabetic, you thank God for insulin. Mm-hmm. If you are not controlling your diabetes, or if you come in and it's uncontrolled at that point, we need to give you some medication to get it under control until we can figure out how to heal you up, how to get your weight down, how to do all the different types of things so that you don't have to be on the pharmaceuticals anymore. If you come in and you are already in chronic kidney disease and it's causing severe hypertension, then you have to be on a high blood pressure medicine to get that under control until we can figure out how to fix the kidneys. So pharmaceuticals are absolutely wonderful, nothing against them at all, but they're not going to heal anything. Mm-hmm. They're there to control a crisis and to keep it under control until you can get to the underlying root and then try to fix it. So when you're talking about structure function care, where you're bringing things from imbalance to balance to homeostasis, and you start a healing process, that is essential for chronic kidney disease. So, if you're talking about dealing with this in a reasonable type of a way, where you can really make a difference, structure function care has to be part of the discussion. If it's not, you're not really interested in fixing the chronic kidney disease. Mm-hmm. So structure function has to be in the loop on that. And unfortunately, it's not. That's why we're having such a problem. That's why the Center of Disease Control is saying, hey, we got a crisis here. What do we do about it? Right.
And we're not doing a good job of...
We're not, this is not being taken care of well. The treatments really... we're not getting any type of results on it. So structure function care is really what we're talking about in here as an answer to chronic kidney disease. And it is the answer to chronic kidney disease.
So how effective is structure function care in the treatment of chronic kidney disease?
Amazing. We've had top-notch physiologists looking at our results, the changes that we're making on the chronic kidney disease, and they're blown away by it.
And you're talking about blood work.
We're talking about evidence-based. We know whether we're making a difference or not. Other people know whether we're making a difference or not. Patient knows whether we're making a difference or not. And we are truly making some amazing changes on chronic kidney disease that really no one else is.
Well, let's talk about the role chiropractic care plays in chronic kidney disease. Someone out there might say, what does that chiropractic
have to do with chronic kidney disease? And that is one of the things that I tell all the patients who have that problem, is we need to get you over there. Matter of fact, a lot of the people who come in who have chronic kidney disease are saying the way that we figure that out is because they're coming in because of low back pain.
Right, what they think is structural, low back pain, which is more kidney issue.
Sure. I had a gentleman who came in, says, I've been to 3 chiropractors, they adjust me, they can't seem to do anything about my low back pain. And I check him out, and I say, there's really absolutely nothing wrong in the back pain is not coming from your back.
Sure.
It's coming from your kidneys. You're in chronic kidney disease. Let's do some blood work on that, see what's going on. But in the meantime, there is not only as we are chiropractors are we adjusting the spine, but we're also adjusting other skeletal structure, but we're also doing visceral adjustments too. So we actually do a kidney adjustment. What happens with the kidneys is that they become inflamed when they're in chronic kidney disease, and when they become inflamed, they drop down because they put pressure, and the kidneys will actually drop. When they do that, they hurt. Also, when they do that, they don't work as well. So one of the quickest ways that we can change some of the numbers on the chronic kidney disease on the blood work is we do an adjustment called a kidney lift. It's a non-painful type of adjustment where we actually lift.
That's good you clarified that.
Yes.
Non-painful. What are you, lifting my kidneys?
Yeah, we lift the kidneys up into place and people go, oh, my gosh, my pain is gone. It just disappeared. And it also, when I do that, we see a decrease in the blood pressure. So the blood pressure actually improves. And then we see on the urinalysis and on the blood work, the numbers improve immediately.
So you're able, and I've seen this, you can palpate.
I can palpate the kidneys, yes.
Chiropractors are great at that.
Yes.
You're trained in that.
And the patients know when I palpate the kidneys, and it's a problem. Kidneys shouldn't hurt. But when they've dropped, they really hurt.
But thank God for that, because that was a warning sign that there's something. It was a warning sign.
Yes.
So if you have low back pain, it could be.
It could be your kidneys. Now, there can also be neurological interference. There is different nerves that go directly to the kidneys, and that could be related to the spine. So doing those adjustments, we've also seen some very good changes in the function of the kidney. So the nerves control everything, so it's not just the visceral adjustment on the kidneys that we do, but also we do the neurological adjustments if they are necessary. But this gentleman had absolutely nothing wrong, no interference with his spine on the nerves going there. It was purely that the kidneys had dropped.
Interesting. How about acupuncture?
Acupuncture. Acupuncture has been our secret weapon. I had a lady who was coming in, and it was advanced chronic kidney disease, and we were working with her, and we had gotten it up to a certain point we had started her out where she had had a GFR of around glomerular filtration rate of about 35, and we'd gotten it up to 45, but we really couldn't get it any higher. We'd spent quite a bit of time, and she was only wanting to do supplements, and I said, we really need to try some other different aspects along those lines. So we tried the chiropractic, which was helpful, but we still didn't see the numbers really change, and then I said, let's go ahead and do some acupuncture, see what that can do. It's another route. She wasn't sure about it. I convinced her. And we did the points on that, rechecked on the blood work, and all of a sudden we were starting to get some moves going on. And we
so it was moving up.
Yeah, it was moving up. So we did about 24 acupuncture treatments, and we were able to get the numbers up to 65, which was a normal kidney. GFR from the acupuncture, because that was the only thing that we had changed.
So why did that work? Although we don't have a whole show for that.
Right. Acupuncture is works along the electromagnetic energy, which is what is around every cell in our body.
Yes.
So if you can improve the electromagnetic energy, it helps the body to heal. And what we're doing is we're giving the nutrients into... we do nutritional therapy. We know what the kidneys need. We test that out. We start to give that to them. But if you don't have the nerve innervation, that's going on there, if you don't have the proper positioning of the kidneys, if you don't have the electromagnetic energy going to the kidneys still can't heal. Yeah, I'm giving him all the products, but we can't get it to stimulate to start the healing process. When you're dealing with structure function, you only get the results that the body gives you. So it's the body that's the hero. We're just trying to provide all the different types of means so that the body can heal itself. And the acupuncture stimulates a very important part called the electromagnetic energy of the body, and it's essential for any type of healing to take place.
Yeah. And I see it all the time.
Yes.
Just being at the office, the changes. Yeah. Well, what role does diet play?
Diet's very important. Even the Center of Disease Control sits there and says, "Hey, diet is critical. You can't overeat. You have to eat the proper foods. You need to get your veggies. You need to get your fruits. You need to cut back on meat." Because it's an extra stress on the body. You need to get enough protein in the system and the right amino acids, but you can overload the body, and so diet is absolutely critical for the results that you're looking for to get the kidneys healed. So you have to have the proper nutrients, but you also have to make sure that you're not adding toxins into the diet. So coffee, tea, pop, all those things are out if you've got chronic kidney disease, because it's an extra stress. So you also need to watch which fats you're eating, that you're eating good fats.
You don't get dehydrated.
Bad fats, you don't get dehydrated, you're taking in the proper water. All the things that are necessary for a healing process.
Okay, when we come back, let's talk about nutritional supplementation and chronic kidney disease. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice. What conditions can be helped with acupuncture?
Well, of course, the sinusitis, tinnitus. We've had some very severe cases of that came in and had some excellent results. Toothache is excellent. PMS, menopausal symptoms. I have many women who are coming in saying, I've heard that it's excellent for hot flashes. Did some acupuncture, and they said, wow, I'm sold. Just because of the changes that occur with that. Headaches, migraines, acupuncture is an excellent adjunctive to that. Parkinson's disease. I have patients who are coming in with Parkinson's.
Oh, yes.
Yeah.
and actually getting some very
yeah.
excellent results.
You can see their gait gets better.
Sure. There are certain points that we do that are specifically have been shown to be very effective for Parkinson's. I know the National Institute of Health is doing some research on that right now with some very excellent results. I've gotten the points from their research that they've done, started to implement them, and I have definitely found that that's been extremely helpful. A stroke, post-stroke, we can get some very good results on that. Cancer patients. A very interesting study that they did on people who were going through chemo radiation, that they had 80% fewer complaints if they were doing acupuncture. So
when they were going through the treatment.
Also afterwards, there are problems with the nervous system afterwards. All addictions, cigarette smoking, we have a lot of people coming in for that, but acupuncture, specifically working on also some ear points along with that, along with the needle points on the body, actually can have some very, very significant improvement on really almost any addiction. I have a patient who came in just to try acupuncture, was actually in law school, and a lot of stress, a lot of things involved with that. And he just keeps on coming in because he says, I do so much better in school. I'm able to concentrate better. I'm able to relax. It just makes such a difference. There was a gal, whenever she was going through the whole CPA program to get certified. And every time she takes tests, she comes in for acupuncture.
Before the test or
yeah,
after?
she says it's better than Valium, just to, kind of keep everything nice and calm, and I can think great.
Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
I'm walking on sunshine. Whoa, I'm walking on sunshine. Whoa, I'm walking on sunshine.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. We're talking today about chronic kidney disease, a silent killer. Dr. Prather, we're talking about the structure-function approach to chronic kidney disease. Let's talk about the importance of herbals in chronic kidney disease.
Well, surprisingly, one of the really good herbals on that is raspberry.
Raspberry. Oh, yeah.
Yeah.
Love raspberries.
Yes. And that has been a herbal that has been used for many, many centuries for kidney disease, and extremely effective. We really find some excellent results along those lines. We also find strawberry leaf very good, some bilberry also
How about
very
cranberries?
helpful. Cranberries is more for pH along those lines, but it can really help out, especially with the obstructive type of thing. But really, the asparagus also is very helpful. We have some asparagus products that helps the kidneys to work better. So really looking at that, those different types of herbs, there's about 100 different herbs. The best one is the raspberry. I mean, it's just like a magic little formula along those lines, and that's a very common thing that we give for people for kidney disease. Also, if they have kidney pains, it really seems to help to control it and keep the inflammation down.
Does it help to eat raspberries too?
Not really. It's more in the leaves and other parts, yeah.
Oh, interesting.
But they prepare it in a certain type of way, and it's extremely helpful for people.
What about nutritional supplementation?
The most important nutrient that we give for kidneys is kidneys. So we give glandulars. Glandulars are one of the important parts of any type of a nutritional type of care. And kidneys, most people don't eat kidney pie anymore. But
what was kidney pie?
Well, you cut up lamb kidneys and then put it into a pie and have that. And that was pretty popular.
When?
But eating organs is one of the ways that you can really heal it up, but it's very hard to get Americans to eat their
organs.
Kidneys. Here, have your kidneys and enjoy. But people don't do that anymore. So what we do is we give them a pill, and it has concentrated kidney glandular in there, prepared in a very excellent type of way, where it's not cooked and you keep all the nutrients in there. And they eat that, and it does wonders. So that is one of the most important nutrients that you can possibly give to the kidneys. Also, you want to look at the protein balance, and the protein that really helps out the most is arginine. So, and that's one of the things that our diet is a little bit low on. And as we give arginine into to the kidneys, we see some very nice changes. So you need the right proteins in there so the body can heal itself. Interestingly enough, kidney beans is very high in arginine. And kidney beans are actually known as one of the things that surprisingly help with the kidney healing.
Kidney beans.
Kidney beans. So those are some of the nutrients, of course. So checking all the amino acids, see what's going on that. Checking that you have the proper minerals, because different mineral deficiencies can affect the kidneys. Certain toxicities along those lines, getting that balanced. High copper, low zinc is one of the common things that
just
leads to
sent out
kidneys.
my hair analysis.
Good
Looking
for
forward
you.
to getting it back.
Good for you. So getting all the minerals in there, getting that all balanced out. Also making sure that the endocrine system is working right. One of the things that occurs is if you have kidney disease, the body will shift how the endocrine system works. So oftentimes you need to supplement the endocrine portion, especially parathyroid can go off. Because of the stresses of the kidney, it puts extra demand on balancing out the minerals. So you have to get that fixed. Also, the potassium-sodium ratio is something that you have to look at, and sometimes supplement along those lines, or put different types of products in there to help to balance out the minerals. So it again becomes a much more complicated type of a process nutritionally than what you would think. But absolutely, if you're looking at a nutritional, getting kidney glandular into your diet really can make absolutely amazing results, because that gives you all the nutrients that it takes to make a kidney. So it's there. As long as the nerve supply, the electromagnetic supply, the blood supply is all getting as it should, then you get the nutrients in there, and the body can actually remake and help heal up the kidneys. So it's functioning
That's encouraging news.
It's very encouraging. And one thing that is not really seen, if you're talking to, even in the textbooks, they say you really can't fix that problem. And, I'm here to say you can.
Very encouraging. So what diagnostics should be done?
Well, blood work and urinalysis is a basis on that. You can tell once it's showing up that there's a problem on the blood work and the urinalysis, you're already into advanced kidney destruction. So seeing that right away is very, very important. Checking on it at least once a year. The best way, it's a calculated number. There are many different ways to even take it into a higher level to find out exactly how the kidneys are functioning. But basically, it's coming from the creatinine and the blood urea nitrogen is how you can figure out the glomerular filtration rate. One of the things that we insisted when we get our blood tests, and most labs do not do a figuring on the glomerular filtration rate. You have to ask for it.
Okay.
So many doctors don't notice that as a problem because the labs aren't giving it to them. So one of the things that the Center of Disease Control said as a fix on that is all basic chemistries that are done should include a glomerular filtration rate in all labs.
Okay. Interesting. So that's part of our Prather profile.
It's part of our Prather profile. Yes, I insisted that is on there.
So who should get these diagnostics done? We have 30 seconds.
Everyone. Everyone at least once a year. Even when you're a kid, you don't think that something like that can happen, but I've seen it happen in 13-year-olds and 10-year-olds, where all of a sudden their kidney function isn't working properly. So having that done on everyone is actually essential.
Okay, well, get your kidneys checked. Thank you, Dr. Prather.
Thank you, Lisa.
The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.